Greetings and welcome everyone to another episode of the Health, Wisdom, and Wealth Show. I'm Velin Hawkins, your host, and our guest today is Dr. Candace Walker. I'm going to tell you a little bit about Dr. Walker, but she is on the cutting edge of all things new in the world of healthcare. And, I have for the longest been calling our healthcare system a sick care system, because once you get into it, it's almost like a cycle that is hard to break out of. And I know of only one way to break out of it, and that is getting well. But if you're on medications, if you are in this loop of putting all of your trust in a doctor who is saying that medications and more medications is what's going to help, then I challenge you to think again. And that's going to be part of what we talk about today. So thanks for joining us, and get out your pen and paper, because I think you may want to take some notes on what it is that we're going to be talking about. But let me very quickly tell you a little bit about Dr. Walker. She is a family practice physician. She has been practicing since 2013 and providing primary care to the state of Georgia. She's a certified yoga instructor and functional wellness practitioner and educator, and is passionate about women's health. Dr. Walker has recognized that in today's healthcare culture, the doctor-patient relationship is gradually fading away, and the rate of burned out doctors is exponentially rising. And that's the truth. They say that physicians are among the highest rate of suicides in the country. And there's a reason for that. She believes that the art of doctoring has become a thing of the past, except she has responded to the chaos with adopting a new philosophy about how she wants to operate within the healthcare system. Meet drcwcares.com, and she values where those who value their health and wellness can access the information and services they desire. Everything from participating in your health and wellness with a comprehensive functional lab panel being ordered and interpreted for you, scheduling consultation, or listening to the Wellness for Bosses podcast for weekly health tips on how you optimize your wellness, or signing up to the My Morning Ritual for a yoga-infused guide to start your day. So we are glad you are here with us to share what Dr. Walker is bringing to us, because she is a speaker and an educator that is going to be talking to me today on the topic: are there holistic health options in healthcare that really work? I believe there are. You're going to find out about them today. Welcome, Dr. Walker. Thanks for joining us today.
Thank you so much. It's a pleasure. It's an honor to be speaking with you. Thank you.
Well, I'm going to just open things up and start at the top. Please share with us. Tell us a little bit about your journey from, when this idea of becoming a doctor came into where you are today, and why you chose to practice, to make the shift and practice medicine in this way.
Oh, wow. I'll definitely have to make this story short. I don't want to take up your entire podcast. But, the moment that I knew I wanted to be a doctor was very early in life. I was in elementary school, fourth grade to be exact. And I often had conversations with my grandmother about health. I often, not necessarily our health, but just about, oh, this is healthy to eat and we should cook things this way. And I was always in the kitchen with her, helping her, prepare food for our family. And she was so knowledgeable, even back then when people weren't really, talking about, food being healthy. It was about your food tasting right, But she definitely valued that, and I definitely value those conversations I had with her. But also, I had a particular personality as a child. I asked a lot of questions and probably asked too many questions at times. And she would say things like, you ask a lot of questions, or, you must know a lot about this. And then she would follow it with, you're probably going to be a doctor or something like that. So I always had this in mind that I could, be or reach this type, or that type of path could be possible for me, because she always saw me in that light. And in fourth grade, I had this habit of going into our media center. And back in the day, that's what, I don't know if they call that the library nowadays in the elementary schools, but we would go into the media center and we would have our free time in there. And I would stay in the science section and I would read about, physicians and um, uh, different types of therapies. I remember picking up a book about sign language in medicine, and I would read about that, just very really off the wall kind of topics. But in particular, I read a book about Dr. Daniel Hale Williams. And for those of you all who don't know, he performed the first open heart surgery um, ever recorded, a Black man and American. And um, that story just really, really stuck with me. That really solidified that, hey, yes, this is possible for you. If he could do it, back when he did, and make such huge waves in the medical field, by setting historical precedents as he did. I knew that I could attain just being a doctor. So for the longest time I wanted to be a cardiothoracic surgeon, because that's what Dr. Daniel Hill Williams was. And I still have a lot of interest in that field of medicine. My mentor is actually a cardiothoracic surgeon. But I did eventually decide to go into primary care for a plethora of reasons. I had great attendings in medical school, and attendings are, those doctors that teach you. So you go into your clinical years and you're, placed under, a certain doctor who's your supervisor, and you learn from that doctor for a set amount of time. And I would go on these rotations in rural Kentucky. I went to medical school at the University of Louisville, and we had opportunities to go all around the state to practice medicine. And some of my greatest opportunities for learning the art of doctoring took place in those settings, because those were physicians who didn't have a whole lot of resources. Their patients didn't have a lot of resources, and they figured stuff out together as a team. And a lot of times, it, it took time not only to explain certain therapeutical strategies, to patients, but these were like family members, to these doctors. They really knew these people in and out, and there was something about that connection, something about that way of practicing, and it was magical in a way, because I saw where the doctor and the patient were involved in the care, in that patient's care. Um, so that being said, I decided to go into primary care, family medicine. I'm board certified in family medicine, and I graduated from residency, and as opposed and decided to go into practice as an employed physician, as opposed to having my own clinic, which honestly I always thought I'd have, forever. That was just my goal, to always have my own clinic. But life happens. I was married, young mother, and I was still pregnant with my second child when I got out of residency, and I was like, you know what, the next best step right now is to go work with the big health system. And I did that for quite some time. Learned a lot, got really burned out, questioned why I went into medicine a lot, to the point where it was really sad. I felt like I was not giving proper care to people. And I say that, I used to be very hesitant to say that, it wasn't necessarily a pride kind of thing, but more so you don't really want to be, walking around saying, yeah, I don't feel like we're really taking care of people. But when you're in a system where it's, about volume, getting people in, getting people out, when you're in a system that thrives off of people going to the hospital, when you're in a system that makes no money from you having a connection with a patient, and you giving not only pharmaceutical advice, but also thorough non-pharmaceutical advice, you're kind of set up to fail when it comes to truly giving care to someone. And that was, a real eye opener to me. I felt like I was not practicing the art of doctoring. I felt like I was not practicing the true essence of medicine. And I decided to combat that burnout with a solution for myself, a solution for my patients. And I truly believe that it was you know, a path guided by God that led me to direct primary care, which has been an incredible journey to learn about. So many opportunities have opened up for me because I came across that concept. And now I'm opening my own direct primary care clinic.
That is awesome. Wow. Yes. And I think that, or I better yet put, I wonder how many doctors really feel the same, that they are practicing medicine for today's pharmaceutically based healthcare system's definition of medicine versus really what medicine was all about. I mean, the thing that Thomas Edison spoke about, that Hippocrates spoke about, in taking care of the patient, what you called the art of doctoring. I love that. But you're right. We have turned practicing medicine into the art of making money. And the healthcare higher ups have figured out how to do that and do it very well. And they've done it now for decades. And they've infiltrated into other industries to help continue what it is that they've created. They've created a food system that has, in fact, created illness in people, that gets them to the doctor, to the hospital, and in this sick care system cycle. They've created the indoctrination with the entertainment industry. What we see, the commercials with got milk, milk that does the body good. That's propaganda that we learned and lived and believed, that we now know, and many knew decades ago that was not true, that it was not healthy. So tell us how did it come that you actually saw what was happening? And I mean, you sound like a very intuitive woman, and I really love that about you. But tell us, when did you pinpoint that pivotal moment? Tell us a little bit about that.
Sure. It was a part of my growth as a person, as well as my growth as a doctor. I once looked at my time working in, under a big health system as a regretful time, as, I felt like I wasted so much time, working, under those conditions. But really it was needed for me to see, exactly what was wrong, with the system. And through that growth, well, I'll start here from, first of all, I personally, I love lifestyle, discussions. I love, talking about, the spiritual side of healing, the mental side of healing, as well as the physical. the social, factors that can even affect, the healing process. And so because I applied those things in my own life and in taking care of my own family, uh, that definitely poured over into how I treated my patients. And I remember when I started frequently hearing the feedback from patients, oh, Dr. Walker spends time with me. Dr. Walker wasn't hesitant about, talking to me about how I could get off of my medicines. Dr. Walker talked about exercise with me. No doctor's ever talked about exercise with me, or, just things like that. And I started thinking, well, isn't everybody doing this? And like, am I the only, I can't be the only person doing this. But at the same time, I would be penalized at times for spending too much time with patients because it was necessary, in my opinion, to go down that path and talk about these things. Like I said, these non-pharmaceutical approaches to whatever their specific concerns were. And, as that started happening more and more frequently, I realized, those are the doctor patient moments that I enjoyed the most. That's when I felt fulfilled. That's when I felt like, okay, I think I did a good job today, as opposed to, the usual rigmarole, getting, 30 patients in and out, and then just like falling out at the end of the day and really not even knowing what happened. you know um, it's one of those things where it was just a natural progression, where I saw the response I was getting, and I saw, hey, there's people out here who do want to heal, who actually do want to learn, who actually come to me and value my input, outside of, can you prescribe this antibiotic or prescribe, whatever kind of medicine, which is fine. We need medicine, sometimes,
Mhm.
but not everybody is coming to the doctor just for that. And I appreciated those experiences where I could really just be real with, the person in front of me, and, talk to them like they're my friend, or like they're my sister, or like they're my mom, and really go into depth as far as mapping out, the root cause of whatever their concerns were.
Oh, that's beautiful. When I think about those who actually give that kind of input into a person's life, I wonder and I think about how they feel when they leave that doctor's visit, because they will then um, do more to participate in their own healing, in their own way back, their own journey back to optimal health. And a lot of times when you miss that piece, that connection from I'm feeling bad to here, let's figure this out, to then sending someone on. um, I've often asked doctors, what else can I do? Is there some other alternative that is out there for me? And they've said no. I remember asking a doctor one time about something that I was dealing with, and they were like, this is going to be a condition that you suffer with for the rest of your life. And I looked at her and I said, oh, no, no, I'm not. And she looked at me, really perplexed and confused, like, how can you say that? I'm the doctor. And I said, there's got to be another solution. And I'm going to be looking for it. And all she could do is say, well, I wish you the best. But, and I was like, no buts, I'm on it. And thank you, because maybe that's what I needed to know, that I could go out here and find more information on my own. And I know that a lot of people out there think that, and doctors are to be respected. They've gone through a lot to educate themselves about disease and remedies for it, but it's been a siloed approach, because what we know about food and lifestyle that can cure so much, even diseases that doctors have said or told us where there's been proof but they've contradicted that proof and told us that they were incurable, like lupus and other many chronic illnesses. We know that lifestyle and food are alternatives. And my question to you is, how can we do more? Do you have any ideas about how we can do more to help people to understand that the responsibility for our health is ours? And if a doctor is saying medication is the only way and there's no other option introduced, how do we handle that? What else do we do?
Great, great. I was hoping to uh, address, this question today. And I'll start off by saying, number one, keeping an open mind, because there are a lot of factors that go into why, certain doctors respond a certain way, to, those, I guess, kind of questionable, diagnoses, or specific questions that the patient may come in with. And we have to heal that relationship between the doctor and the patient. So I say keep an open mind, because yes, that doctor may just be a terrible person. There are people with bad personalities versus, that doctor, may be under some very, very heavy constraints, and they're literally just trying to get through their day. Um, and that's, while it's not, of course, in the bigger scheme of things, an excuse, at the same time, it's a reality about the pressures that doctors are under on a daily basis with every single visit. So keep an open mind. On that note, though, be prepared. So one thing that I love to do with folks who are, willing to, learn and listen to this is understanding how to prepare to go to the doctor. If you just go kind of blindly and just, it's like, okay, well, whoever I see, I'm just going to go with whatever they say. And, I may be upset at the end of it because, I didn't get everything I needed out of that visit. When I say be prepared, meaning, have those questions ready ahead of time, tell the nurse your questions so that the nurse can then let the doctor know that, hey, they're prepared. And the doctor kind of has their almost a different mindset walking into the room, because they know that, hey, we, this patient has an agenda, and we can really focus that little time that we have on making sure we get to, that agenda, so that they walk out of here feeling like, time wasn't wasted, and they don't feel frustrated. So I just wanted to just touch on that point. But, as far as, getting to the point where, uh, you know, we're using our resources in the most effective way. I think that patients feeling empowered to, educate themselves, um, feeling, again, open-minded enough to try things that may not be so traditional in a sense. Um, and we can go into that later, different type of, I hate calling it alternative therapies, but I guess in a sense that's what it is. Being open-minded about that. And then also, physicians accepting the fact that, as physicians, if we're looked to as teachers and guides, we also have to be a forever student. We learn the basics, physiology, anatomy, we've got the biochemistry backgrounds, all of that. And, we've practiced, under attending doctors for so long. And, now we're in our practice. And even though we're under all of these constraints by big hospitals, health systems, big pharma, because folks are depending on us at times, a lot of times to, direct their next steps, we have to continue to be a student, and not only a student to, and I don't want anyone to be misguided thinking that doctors aren't, always, studying and learning, because we literally have to keep our license. The thing is, there's certain things that the boards, keep us focused on. We have to decide whether or not we're going to continue to expand our knowledge past that, so that I can address all of the questions that, Miss Smith has come in with, because she Googled, lupus, for example, and she wants to ask me about certain herbs or certain supplements, or whatever she wants to ask me. I want her to feel like, oh, my doctor respects the fact that I have these questions, and is willing to guide me on my next steps. Now, at the same time, I've had people come in and tell me about something, and I just had to be honest with them. I've never heard of that. However, thank you for introducing me to it. How about I look into it, and let's follow up and we'll talk about it, next visit. And one thing that I love about, this situation I'm in now with my new clinic is that, I will have the capacity to, just call that patient up, once I'm able to read up on this and really take a deep dive, into their concerns. So, educating ourselves, keeping an open mind, I think that's going to be, really the first stages of us getting to the point where we can trust each other and really start to make our communities healthier.
Wow, I love it. And I really appreciate what you've brought in there, because it is a message to doctors. I mean, I know that most doctors receive either 0 or very few hours in nutritional education in medical school. So to be fair, asking them about what, foods they recommend you eat, unless they have learned that outside of their medical training, they don't know the answer to that. And I appreciate how you've brought in the ability to say, I don't know. And, depending on the doctor, I have heard many doctors talk about how their patient introduced them to the idea of the impact of good nutrition in curing a particular ailment. And they've gone ahead and done the studies. And, I think that we are part of the ripple effect that is going to actually help or reach more doctors and help them to say, maybe that's why I was feeling that way. And maybe that is something to take a deeper look into. Um, I think that it's something that in medical school, really showing the student doctors that there is this piece will help to create the change at that level that then permeates through the medical industry. We can affect change from the perspective of the patient, individually as it relates to the doctors. And I think that more patients are amenable to reaching out to their insurance companies to inquire, I'm looking into doing this therapy, or I'm looking into doing that, and it's not covered. How can I get this covered by my insurance? I think that is the way that the FSLA accounts came into being, and the supplemental accounts that people can set up. And I think that insurance companies are looking more favorably to the idea of preventive medicine, because there's a lot of money in that too. Money is their motivator. Let's look at how the money can get shifted, and shifting to more of a proactive approach in preventive medicine, I think, is truly the way that it's going to come from patient and insurance company back into the system, and integrate doctors more prevalently. But let's talk about preventive care. Are you doing things or planning to do things in your practice that actually focus on preventive care? And how are you planning to do what are you doing now? I know that you're a certified yoga instructor, you do all these amazing things. I'm going to check out your morning ritual. Um, but tell us a little bit about this preventive care side of things.
So preventive care is my expertise. It's to me that is the foundation of primary care. Um, you know, if we can prevent the disease from happening, of course, we can keep people healthier. Um, so as far as how to implement or how to how do I plan to practice this way. I'm going to do what I've been doing all along, as far as how to approach care in a way that encourages others to really take control of their own health and wellness, to realize that, they're the captain of their health. I'm a member of their team, and their personal trainer can be a member of their team, or, whomever, but, they are the captain, they're the quarterback, and when I can get someone to be an active participant in their care, those are the times when I feel that really teaching from that perspective becomes a lot easier. um, what I think is imperative that folks have is an annual physical, and unfortunately it's probably not the physical that you get nowadays, because nowadays the physical is really catered to what the insurance company says that you need to get in order to in order for them to reimburse the clinic for what the doctor's done. And as we know, that's not always to our benefit as patients. But a really thorough physical exam, head to toe. Your physician needs to know you physically, mentally. I love when I can, connect on a spiritual level, to patients as well. Um, but all of that helps when you're trying to treat the whole person, when you're not trying to focus on one little thing, when there's all these issues going on, in the other parts of the body, or other parts of that person's being. And preventive care, true preventive care, in my opinion, really and just embraces that integrative approach. Um, and integrative has become kind of like a blanket term for a lot of things here recently, and that's okay. I think that's great that you know uh, different doctors have a different area of expertise. They have different areas of interest, and that just opens up the options for people. So for me in particular, I feel strongly about not only guiding people on whether or not they need medicine, and if they do, what type and how long and all that kind of that kind of information, but also do you need supplementation, what kind of supplements do you need, which supplements do you need to stop taking, um, that's information that I feel you should be able to get from your doctor. You need a trusted source when it comes to these things. There's a lot of products out there on the shelf, and the makers of these supplements a lot of times don't have your best interest at heart, as well. So you need guidance in all those kind of areas. So supplementation, one thing that I'm also providing at my clinic is IV infusion therapy. I feel that that is a very efficient way of getting the supplementation that you may need, the hydration that you may need. And it's a very easy way to for your body to absorb those types of things. And again, this is a non-pharmaceutical approach to possibly healing someone's migraine, or you know uh, stopping abdominal pain in someone who, they haven't been able to figure out why they have this chronic abdominal pain. Well, sometimes it could be as simple as they're not drinking enough water. Go figure, and
Hmm.
in those instances, we need to, rehydrate. We need to get that supplementation into the person. Other types of what I consider preventive type of approaches are things like movement therapy, meditation. Um, you know, if you have high blood pressure and no one's talked to you about developing a meditation practice, you have not gotten the care that you needed. It's, I mean, hands down. I mean, this is at this point in time, it's science. Has proven that this helps. To not only calm you down in general, but it actually has an effect on the pressures in your blood vessels. I mean, like I said, this is science. And when I say we, I mean, doctors in primary care have a very unique position in that we really get to develop these relationships with our patients. It's one of my favorite things about being a family physician. And when I can discuss things like that with my patient, and I know that they're coming to me to get this kind of information, it makes my job fulfilling. you know so as a preventive care doctor, I want to be able to kind of be that central kind of station, for the patient, so that, whether they're, perfectly healthy and just trying to stay on track, I want to be there for them, versus the person who's on, multiple medications, and, we're seeing where we can, you know, really help to make their quality of life um, uh, spectacular. I feel like you should have great big expectations when it comes to your health, and I want to be a part of that. And for me, preventive care, like I said, is the foundation of really helping somebody to reach optimal health and wellness.
Beautiful, beautiful. So let me ask you this. We've been through the last 2.5 years with a situation that's been part of the roller coaster, which we have yet to see the true impact of. But what did COVID teach you that you have formulated and implemented through the work that you do?
Hands down, health has to be a priority. Hands down. you know um if anything, and I mean, this is beyond, the debates on, vaccinated versus not no, no vaccine, mask versus no mask, whatever. At the end of the day, your immune system has to be strong. At the end of the day, um, you've got to have, your health has got to be strong enough to fight off whatever it is, COVID, flu, whatever kind of bug, you come across. Your body has to be strong enough for it. And it opened the door for this huge opportunity for me as a doctor to really layer on the lifestyle modification lecture. As I tell my patients, I'm always like, all right, prepare for the lecture. But now people are more open to listening to that, because they want to know, what can I do to protect myself, from COVID? I'm double vaccinated, double boosted, all that kind of stuff. And I still got COVID twice, like, what do I need to do? And, when it comes down to it, I really, really try to keep it simple. Let's go back to the basics. What are you eating? Are you staying hydrated? Are you moving every day? What are your relationships like? How's work going? We've got all these stressors, and how are you offsetting that stress, that's coming in? Those are the kind of questions that I I want to know the answers to, so that I can, really guide you on those lifestyle changes. And, you know, yeah, I mean, COVID has obviously flipped the world upside down, but it definitely has opened the door for that conversation of lifestyle in every community.
I agree. And I think that we have to take advantage of that fact by making sure that the information is going out there for people to find. I know that's one of the reasons that I really felt called to host this show. And now we're a podcast show. And there are a lot of health shows out there, but the practical matter is if people are avoiding these shows because they'd rather listen to sports, yet they're ailing and don't know where to turn, maybe this will slide in there somewhere and be the catalyst for them to find more information to create change. Now, I know that you and I talked about this thing called direct primary care. And it is something new that a lot of people probably haven't heard of because we've been in the system. And most of what we know and talk about is about the current healthcare system. But tell us, what is direct primary care and how is it that you're involved with direct primary care?
Well, as I mentioned before, in my quest to figure out a solution to my burnout when I was working with a big health system, I came across this concept of direct primary care. It's been around for, I don't know, at least a decade. And I would just ever so often come across articles about it. I read about one of the first physicians to kind of start it up, and how he, fell in love with medicine again. And, it was like everything I wanted to hear, And so, I would read about it every now and again. And I noticed how it just seemed like it just kept popping up everywhere for me. But of course, it's, not something that a lot of people really know about. So it's not like I was talking about this to colleagues, or anything like that. This was just kind of like my own kind of personal search, where I came across this. And so I, just started learning about, okay, what is the foundation of it? Well, I love the foundation of it. It's based on, the doctor-patient relationship, really reconnecting, that bond. A lot of folks describe it as practicing medicine the way it used to be, when you really knew your doctor was like a part of your family. So that really drew me into it. But then I started learning more about it. It promotes, smaller patient panels. And what that means is that your doctor, as opposed to being responsible for 3,500 people in your area, DPC doctors usually keep their panel under 500. Huge difference. Okay. Very huge
Mhm.
difference. So that means that, you've got more access, better access to your doctor with hence the name direct primary care. So you have that direct access, usually via, phone, email, text, whatever, in addition to, being able to come in and see your doctor, physically. Direct primary care, they've been doing telemedicine for a long time, because it was just another, channel that they could connect with their patients. You usually, or not usually, you will have longer appointment times because there's not a waiting room full of 20 people, waiting on the doctor. Again, that smaller patient panel allows for that. That it is a subscription-based model. And I think that may be why it hasn't quite caught on so fast. I think a lot of times we're kind of afraid of that that term, like, wait, what? I've got to pay monthly, for, a physician, or is that just like concierge medicine, which there are definitely some differences between direct primary care and concierge, and we can definitely go over that. But direct primary care because of how it's because of the infrastructure, it's actually in a lot of cases more affordable for any one individual than actually, going to your doctor under your regular insurance coverage and not really being taken care of fully, which means you're probably going in more and probably having to spend money on medications now, probably having to go see the specialist now because, nobody knew about the, weird heart sound, in your chest, because you probably hadn't seen your doctor in a year or so. So it really helps to not only with that lack of access to your doctor, but it really helps to keep the patient healthier. Because you have a smaller patient panel, there can be plenty, of DPC doctors in one community. You want that, you want to find the person that you connect with. So I am definitely on a mission to like get more colleagues into direct primary care because number one, I know that they're wanting something like this, and I don't see it as competition at all.
Mm-hmm.
Another thing, with direct primary care is that those clinics can have kind of like whatever their theme is, however that doctor likes to practice. So for example, preventive care is my thing. I'm really big into, yoga and IV infusion therapy. And so I'm able to easily implement that into the care, of my patients without, the middlemen, in the way telling me, oh, well, no, you can't have that, or that takes too much time, or the, ROI isn't there, for that kind of, that kind of treatment. So, we can't put that in there. I get to practice it my way, and I've got patients who are seeking the type of care that I'm giving. So then, yeah, that barrier that, administration, health system, insurance company, that barrier that they create gets basically, just thrown out the way. And now you've got the doctor and the patient together again, and
Mm-hmm.
everybody's healthier.
Beautiful. Yes, we need more of that, and we need more of the practices that, when you were saying that, I had the vision of the practice that had, 3, 4, or however many doctors within that practice who had their own specialties. And I envisioned that they had their, maybe morning huddle where they're like, I had a patient yesterday and I know that they need XYZ. Can you do that for them? And you've got the resources right there to be able to, help a patient of a doctor, but you've got your own referral network, so to speak.
Mhm.
And I think that is what's going to make the new practice of medicine the old practice of medicine, because that's how they used to do it back in the old days. When I was a kid, I know that I had a primary doctor, but out of his office, he says, I'm going to refer you to this doctor because that was part of his network. And he's
Mhm.
like, he's more well versed in this area. So go talk to him. And, Dr. So-and-so referred me to come talk to you about this. And you were in on the calendar. It wasn't like, you had to go through all this other stuff. And I
Mhm.
really think that we're remembering, and we'll talk about that for just a moment.
Mhm.
We're remembering our past healthy lives, and we're
Mm.
being called to pay attention to what we're
Wow.
remembering. And, when we talk about the spiritual side of things, I think people intuitively are
Mhm.
remembering how they felt when they weren't carrying 100 extra pounds, and remembering that, I might feel okay now, but I felt better then. How do I get my now to be better and feel like that again? Feelings can happen again. The way that you were 10, 20 years ago is not going to happen again, but that
Mhm.
feeling that you had can. And I want to say that, you know, when we're talking about that, it really brings to mind the importance of the movement, yoga, getting out in nature, the um, what you brought in just a minute ago that just totally flew out of my head. But talk to us a little more about the real importance. I mean, even the way that you were kind of running down these things, drinking, sleeping, and eating the right foods and exercise. They're some of the six pillars of lifestyle medicine. But tell us the value that you actually see and place on this movement and getting out into nature.
Wow. Um, wow. So first of all, it's, this is bigger than, my life as a physician. Um, these are concepts that I am instilling in my children. Because I want them to be, their healthiest selves. The legacy I want to pass on, you know, to my children and my grandchildren and greats is that healthy lifestyle. That's what I want for them, um, above anything. And, I feel like that is the gateway to success in all the other areas, all the other aspects of their life. So, you know, I love how you put it that we're all remembering, you know, and it it's so true. Everyone's walking around just uptight and stressed and hurting, and it's we're over it, we're over it. We realize that, okay, there's only so many, pills you can take, and there's only so many days you can go, feeling like this. There's got to be something different. And that's when, the beautiful system that the human is starts to, go back to the basics, you know um so I think it's a very powerful movement, and I, pray that as a collective, that, more and more of us, get connected on this same vibe, and really, move towards, uh, a more holistic whole body approach. I know I kind of cringe, honestly, when I use these kind of words, because I don't want to be boxed in, to any certain genre or anything, when it comes to taking care of people. But the real strategy is taking that whole body approach and applying that to anything you're doing, whether you're eating, whether you're going to work, whether you're um, drinking fluids, whatever you're doing, whether you're deciding not to exercise. It's, more than, for instance, exercise is more than about losing weight. This is about your body being able to move easily. This is about you being able to hold yourself up, and sit upright. This is about you not having aches and pains because your muscles can't support your joints. This is about you not having fractures when you're 70 years old because your bones are less dense. Like, it's so much more. And that was just a fraction, of the importance of exercise. So you know it's it's a very powerful movement, and I'm just happy to be a part of it. And like I said, I'm a forever student. It's one thing that I learned in those rural rotations in Kentucky, to be a forever student, because, I'm not always going to, have a magic pill or a magic, you know, op- operation that can show up, with the best surgeon to do this or that. You have to make do with what you have. And that just comes to going back to the basics. And that's probably why, because we're running out of options and we have to go back to the basics.
Yeah, yeah, I totally agree with that. Um, this has been such a joy to be in this conversation with you. And as we're wrapping up, is there one piece of advice, one thing that you can share with our audience to basically help them to walk away with something that they can keep at the top of mind and take action on? Please share it with us.
Well, first off, thank you so much. This has been so fun. I can't believe we're it to the end of it now.
I know, I
I
know.
could talk forever about medicine, but yes, know your options. Know your options. You know, while yes, our health system has a lot of issues, it's great for some people. And while, there's other options in healthcare, that's great for other people. I believe that direct primary care can be a great option or is a great option for a lot of folks as well. Know your options so that you can get the best care that you could possibly get for you and your loved ones. I want you to live your healthiest life, and we need to utilize the resources that are out there. So know your options.
Thank you. Wow, this has been so great. A conversation that's definitely needed so that people know that there are some really great options out there. And while it might take a little bit of work to find what it is that you need and that you're looking for, Dr. Walker is there. And so reach out to her. You will find how to get connected with her below this video to see what she's up to connect, to maybe even get into that morning ritual yoga with her, like I am. And do reach out. And please share a comment below. Let us know if this was valuable information, what your biggest takeaway was, and share. What we're looking for is the ability for more people to hear and understand the conversations that we're in. And it helps when you share what you've experienced. So for now, put your comments below. Let us know what you're taking away from this conversation and invite others and watch for what's ahead on the Health, Wisdom, and Wealth Show. I am Velin Hawkins, your host, and it's been my honor and pleasure to have Dr. Candace Walker here with us today. Thank you so much for bringing this conversation in. And to our audience, we've got some exciting things coming up in future episodes. Check out past episodes. Go to the website. Find us on Facebook and LinkedIn and YouTube. Subscribe to our channel on YouTube. And remember, be well, live, love, and be a bigger positive impact maker in your world. And we'll see you next time. Bye for now.